On-time ICT services for use cases of COVID-19 response.
Hello, this is Tae Han, a research professor in Yonsei University Hospital. I'd like to explain on-time ICT services for use cases of COVID-19 response. As global spread of the COVID-19 continues, major international organizations such as World Bank, Asia Development Bank, and OECD are requesting Korea to share Korea's own experience on handling the COVID-19 outbreak. They are especially interested in the cases that Korea used ICT and AI in the process of handling the COVID-19 situation. Therefore, we'd like to find out the COVID-19 responses that use in innovation technologies. This course consists of basic information about COVID-19, web and app services to respond to COVID-19, COVID-19 response system, studies and cases related to COVID-19, and insight from on-time ICT services for COVID-19. Here are 4 course objectives. First, we aim to find out of the movement through the web since when COVID-19 has occurred, and then we purpose to be aware of specific functions and characteristics through the app, which is for the prevention of the spread and understand the current status of ongoing services and platforms regarding COVID-19. Finally, we will follow up ongoing researches in domestic public organizations and the ways of response in public health regarding COVID-19.
Before we start, let's have a look of COVID-19. It has been found from unrevealed coronavirus from someone's lower respiratory tract. It has been named for severe acute respiratory syndrome, coronavirus 2. Common symptoms are fever, sore throat, and breathing problem. Also, from the recent research, this disease is spreading via droplets. Recently, there are no vaccinations or specific antiviral agents, so it is best way to manage them through social distancing, hand washing, and wearing a face mask. Next, let's take a look at some actions that take places in Korea. Koreans use ICT technology to prevent spreading COVID-19. This is about website to support COVID-19. In March 2020, Korea Electronics Technology Institute, KETI, and Korean companies such as N2M, D-Tonic, and Fine CNI worked together to develop the COVID-19 Smart Management System. This system was introduced as COVID-19 Contact Tracing System in this course. This system is for the confirmed cases, and it is a system to quickly analyze the route such as location information, car details, etc. Also, it quickly grasps the movement route and finds the infectious route and critical area through space-time analysis. Previously, when the Korea Centers for Disease Control and Prevention requested information, it had difficulties for the collection and analysis of information. It was complicated to get information from related organizations. In addition, requesting information were implemented from the scratch, and it took so long, such as writing official documents and contacting to the related organizations. According to the transition to the developed system, the request, authorization, delivery, and verification of this information could take place in the integrated system. It also reduces the time required to analyze epidemiological investigations in less than 10 minutes. It has benefits of reducing the workload and responding quickly. Even though large-scale infections occur, it is possible to respond faster than any other country. The technology used in the COVID-19 Smart Management System is a smart city data hub technology that collects and analyzes large-scale big data in real time. If the location information and movement path of a person infected with COVID-19 is tracked and displayed on a map, clusters with a high speed of infection can be predicted. It has also been able to focus administrative capacities on preventing infections earlier. Access to the system and information is limited to the minimum required number of people, and the access and analysis of information is designed so that other government agencies cannot access and utilize it unless KCDC and epidemiological investigation are available. Next, Clova CareCall is the first AI service in Korea that automatically calls COVID-19 suspected infection people to check and report their symptoms. Clova CareCall was developed by Naver in March 9, 2020, to help respond to COVID-19. It is used by Public Health Center in Seongnam City, Korea. Before the introduction of Clova CareCall, Public Health Center workers had to make more than dozen calls to people all day long. Now that AI makes phone calls automatically to check for symptoms and sends reports. So public health workers are responding to COVID-19 very efficiently by simply checking reports and checking those who are abnormal. Let me explain the service flow. There are 3 health centers in Seongnam City. When the confirmed case is founded, they send the list including persons required active surveillance to the Clova CareCall system from time to time. AI Clova CareCall automatically calls 3,000 to 4,000 calls a month. In terms of human labor, it can perform amount of 30 people's work. In mid-May 2020, the number of people has reached to more than 750. It worked successfully more than 1,500 calls a day. Clova CareCall has an 81% success rate, so health workers can do their jobs efficiently by managing only the rest 19% people and people who have symptoms. The following is a GIS system applied to prevent the spread. The Geographic Information System used in the COVID-19 Smart Management System is an information system that can analyze and process comprehensive information by extracting and combining spatial or attribute information required from numerous data files with diverse spatial and attribute data. Korea Spatial Information and Community, KAON-I, and WiseNut have collaborated to produce a domestic COVID-19 situation map in Korea. The COVID-19 situation map in Korea shows data such as the location of the confirmed cases, screening stations, Shincheonji facilities, and markets to purchase masks after receiving data from the National Geographic Information Institute, Korea Local Information Research and Development Institute, and KCDC. The followings are the services which were created after the public data for the public mask was opened in March 2020. The apps that check mask-related information includes Wear Masks, Mask Saja, Masks Around Me, Mask Reminders, and My Masks, and the functions are all similar. The following is epidemiological investigation through contact tracing app. Apple and Google have developed an interface for contact tracking or COVID-19 infected patients. This function uses the phone's Bluetooth function to accumulate time data associated with the signal strength when Bluetooth is connected to each other if you enter within a certain distance. At this time, if you update the situation that the connected person is infected with the COVID-19, the system is sent a notification to recommend the test to the people in contact. The picture above shows how to use it on Android-based phones. In Google Settings, the service is available by activating the COVID-19 exposure notification setting and installing Bluetooth, location, and application. The following is a self-quarantine safety protection app to prevent spreading COVID-19. This app is developed for persons under self-quarantine and public officials in charge. It supports the monitoring of the self-quarantine in local governments by diagnosing the health status of self-quarantine on its own, automatically sending notifications to the case officers when the person under the self-quarantine leaves the quarantined area. The person under the self-quarantine should install the app and register his or her personal information and the quarantine area's address. If he or she leaves the designated quarantine area, it will be notified to the app for the self-quarantined and the case officers. However, there is a problem of not being able to check when the person leaves phone behind. The safety band on wrist came out to compensate for the shortcomings of the self-quarantine safety protection app. The safety band is provided only to violators of self-quarantine guidelines and is automatically notified to the dedicated public officials through a Bluetooth connection with the self-quarantine safety protection app when the device is out of the quarantine place or it is damaged. It is disposable and can be worn for up to 30 days. The following is a mask app that supports for the activities to prevent of the spread. Based on the open data provided by the Health Insurance Review and Assessment Service, many mask identification apps have been developed. The most basic form is an app that provides information about the location of the store, the number of masks, the nearest mask store around me, and the mask selling shops far from where a COVID-19 patient had visited. What's more evolved here is the Naver and Kakao apps. Mask-related information can be displayed using the map application without installing a separate mask app, and location guidance in the store has been added to the app. There are Kutak and Toktak apps with this mask-related information and EMR. Both apps can manage patients through EMR, allowing you to book for hospital visit, request a prescription, and receive no-contact telehealth through mobile devices. The following is a Corona Ita app that informs you of visit information of COVID-19 patients based on your current region. If you search for a place you want to visit in Corona Ita app, you can check information on whether the patient visited and the place is disinfected or not. Smiley icon means that COVID-19 patient has not visited the searched place and has been recently disinfected. Crying icon means that COVID-19 patient has visited near the area. It is the app that helps citizens go out safely by notifying the danger of the area where COVID-19 patients have visited and safety of the stores that have completed disinfection. The following is an epidemiological investigation using QR code. In order to ensure the accuracy of the list of visitors during the epidemiological investigation of the risk facility for mass infection, the government introduced KaiPass, Korea Internet Pass, which is an electronic registry using QR codes. The facility user receives a personalized encrypted QR code and presents it to the facility manager. Then, the facility manager scans the QR code and allows the facility to enter and exit. Here, the scanned information is automatically sent to Korea Social Security Information Service. In this process, the QR code providers manage the user's personal information, such as name and phone number, while the Korea Social Security Information Service manages the facility information and QR code records. As a result, the facility manager cannot check the user's personal information, and the government uses the QR code visitor list in mass infection. The following is a COVID-19 quarantine robot developed by SK Telecom and Omron jointly in order to prevent COVID-19 infection. AI-based recognition technology is applied to the robot, which performs measurement of the body temperature of the visitors, advice on wearing a mask and social distance, and takes quarantine measurements using UV lamps. In addition, the Metatron technology, a big data analysis solution, is applied to collect and analyze data of major parts through sensors attached to the robot to predict the current status of the robot and to predict when it needs maintenance. The following is a response through the project to prevent the spread of global infectious diseases. KT and KCDC developed a service called the Global Epidemic Prevention Platform, GEPP, based on the Personal Information Protection Act, which allows personal information to be used in disasters or emergency situations. In the past, it was difficult to confirm whether passengers stayed or passed through infectious disease-contaminated areas when they were traveling through infectious disease-free countries. In order to solve this problem, KT can quickly respond by identifying overseas routes and providing infectious disease information by sending precautions for prevention to visitors to countries with infectious diseases to SMS and providing only customer information to KCDC. In order to spread GEPP actively, the company planned to provide risk information related to infectious diseases only to users who subscribe to the service, and to provide risk guidance services to all mobile phone users by identifying information on visits to affected areas in case of emergency. Next, let's take a look at research cases related to COVID-19. In cooperation with the Ministry of Health and Welfare, the Health Insurance Review and Assessment Service, HIRA, releases anonymous data of the confirmed cases in Korea to effectively respond to COVID-19 and conducts collaborative research with academics and government agencies around the world. This study is based on all national medical billing data held by HIRA and standardizes electronic medical records (EMR) data of foreign medical institutions and foreign clinical data, which helps to make decisions when conducting treatment in clinical settings. It will also support for policy making. The study is the first case in which data is collected, refined, and released to researchers around the world as public data when COVID-19 infection is in progress. This data has been provided since March 27th in 2020, and we are planning to provide the statistical data of the COVID-19 test results and a bill of medical expenses until the end of the COVID-19 situation. The following is an example of data released by the National Health Insurance Service, NHIS. The NHIS COVID-DB for COVID-19 response system and evidence generation has been provided to researchers since June 15th. Considering the importance of the COVID-19 related research, the review process was simplified and about 30 studies were approved after 2 reviews by assigning a dedicated analysis center for the related research. Also, just in case it comes the second epidemics, NHIS plans to use the medical capacity analysis according to COVID-19 and identify problems in the healthcare delivery system to establish practical measures. Here are examples of COVID-19 response from hospitals. Seoul National University Hospital has signed an agreement with LG Electronics to prevent infection in the hospital and is using cleaning robots and guide robots since March 2020. Chloe CleanBot uses indoor autonomous driving and obstacle avoidance technology to clean hospitals which are complicated, while the Chloe GuideBot conducts temperature measurements and respiratory tests for all visitors. This reduces the risk of transmission by turning the employee's routine checkup into non-face-to-face. Korea University Hospital is also managing personal hygiene by installing a robot that carries hand sanitizers to help prevent the spread of the virus infection. Halim University Hospital introduced medical ward access control system by applying AI facial recognition technology, which patients and visitors can have access the ward in only 0.3 seconds without any contacts since February 2020. Previously, patients and visitors were inconvenienced because they used separate passes and wrote hospital entrance records manually. The introduced AI facial recognition technology enables non-contact, increasing the effectiveness of infection prevention and automatically saving all access records of patients and visitors through individual ID registration, enabling accurate movement identification. While the aforementioned hospitals focused on responding to infection prevention, Yonsei University Hospital developed a location-based infection tracking system in April 2020 that focused on response after the outbreak of infectious disease patients. The solution provides inpatients with Bluetooth tag bands and attaches high-density network terminals throughout the building to receive Bluetooth signals, monitor inpatients' movements in real time, and use them for safety management of inpatients. Previously, it was difficult to identify the infection channel by checking the hospital CCTVs based on the memory of the infected. The introduction of the infection tracking system has provided very quick and objective results, including successful identification of the pathways and contacts of the infected, and we expect them to be useful in responding to COVID-19. The technology used in the location tracking system is based on Bluetooth Low Energy, and the real-time location system is the most suitable technology in indoor spaces where obstacles exist. This is the first case in which location information tracking technology has been applied to inpatients in Korea, and it can reduce the social cost of tracking contacted persons with the infected and contribute to the prevention and spread of the infection. Finally, let me wrap up the session. There are two main aspects about COVID-19 responses with ICT. From an industry perspective, there were cases in which existing products or solutions were added with indicators related to COVID-19 to enhance the solution to the situation, and new products and solutions were released after the COVID-19 crisis. From a social perspective, data acquisition and analysis have enabled us to provide data for each country's characteristics. This enables companies and industries to obtain the environment and standard reference content needed to develop solutions. Based on this case, we will be able to successfully respond to infectious diseases in the future if we establish a development guide for each spin-off and startup industries and a national and regional standard content guide. Thank you for listening and attention.